Parathyroid glands. The four parathyroid glands located posterior and adjacent to the thyroid glands regulate serum levels of calcium in the body of controlling the rate of bone metabolism through the secretion of parathyroid hormone. This hormone is unique in that it is not under the control of the pituitary gland but rather is controlled by a negative feedback from the circulating serum levels of calcium and how much vitamin D is present to allow of absorption of calcium from the gastrointestinal tract into the bloodstream. Hypocalcemia is a lowered blood calcium level that occurs to some extent in all newborns before they begin sucking well. It occurs because phosphorus and calcium levels are always maintained in an inverse proportion to each other in the bloodstream. Hypocalcemia may be caused, therefore, by a change in either calcium or phosphorus metabolism. Hypocalcemia tends to occur in infants who experience birth anoxia. Phosphorus is released with anoxia. In immature infants, the parathyroid glands are immature, and infants of women with diabetes. It tends to accompany the hypoglycemia that occurs in these infants shortly after birth. The chief sign of hypocalcemia is neuromuscular irritability, referred to as latent tetany. This occurs if the blood calcium levels falls below 7.5 mg. The newborn will demonstrate jitteriness when handled or if the infant has been crying for an extended period. If the blood calcium level falls well below 7 mg, manifest tetany may result, which is commonly observed as muscular twitching and carpopedal spasm. Abduction of the hand and flexion of the wrist with the thumb positioned across the palm. In pedal spasm, the foot is extended, the toes flex, and the sole of the foot cups. Without therapy, at this point, generalized seizures or spasm of the larynx with the infant emitting a high-pitched crowing sound on expiration can occur. If the spasm is prolonged, respiration may cease. Treatment is aimed at increasing the calcium level in the blood above the point of latent tetany. This can be administered orally as 10% calcium chloride if the infant can be well sucked. Otherwise, it will be given IV as a 10% solution of calcium gluconate. Newborns who are having generalized seizures may require anticonvulsant therapy in addition into the calcium gluconate to halt the seizures. Emergency equipment for intubation to relieve laryngospasm should be available. After immediate therapy to increase the low blood calcium levels, infants are given oral calcium therapy until their calcium levels stabilizes at greater than 7.5 mg.